I'm Dr. Bridges. I'm back with session 2. Let's talk about how we make the diagnosis of diabetes. What are the diagnostic criteria? First, most common way of making the diagnosis of diabetes is with a fasting blood sugar that you would go to the lab for and have blood taken out of your arm. You would need to do this on 2 separate occasions, and if your fasting blood sugars are greater than or equal to 126, that would constitute the diagnosis of diabetes. And please note, this is after 8 hours of no caloric intake. Another way of diagnosing diabetes is with a 2-hour plasma glucose of greater than 200 during an oral glucose tolerance test. I don't think we order this much anymore, but if your doctor happened to order it because of some suspicious reasons and found the blood sugar to be over 200 at hour 2, then that would constitute diabetes. The most common way, I believe, we diagnose diabetes is just with a random blood sugar on routine blood work. And if we find it over 200 and we discover that you have some of those classic symptoms of diabetes, then we can very confidently make the diagnosis of diabetes. Another way to diagnose it is with a hemoglobin A1C of greater than or equal to 6.5. And I'll talk about the hemoglobin A1C here in just a bit. How about right now? Okay, the hemoglobin A1C, also known as glycohemoglobin, is a blood test that can be taken out of your arm, or in our office, we take it out of the fingertip. It gives us an idea of your average blood sugar over the past 3 months. Let me give you an example of how important that is. First off, it allows me to determine what direction you're going in regards to your control. Are you getting better, or are you not going in the right direction such that I need to make adjustments in your therapeutic regimen? I also have some ornery patients that are out of control much of the time, but 2 weeks before they come into my office, all their numbers look perfect when I download their meter, but yet their A1C is very high. So I know what they've been up to for the past 3 months. So it gives me an idea of the average blood sugar over the past 3 months. If you don't have diabetes, your A1C is typically going to be less than 6. Now, the goal for people with diabetes is always individualized, not so tight or near normal for elders and children. But if you're in the prime of your life, we're going to do our best to get you under the best control possible and do it safely. That's the art of diabetes management. So we generally would like your A1C to be less than 7, providing we can do it safely. This test is done usually at every office visit, about every 3 to 4 months. If you're pregnant, we check it every month. This test is like a grade card. It tells us how you're doing overall, but it doesn't give me an idea of how to adjust your medicines to customize your regimen to fit your needs. That's why I need blood glucose monitoring data to help me with that. Now, the higher the A1C number, the higher the average blood sugar. So remember I said the ideal is 7 or less. Well, a 7 A1C is an average blood sugar of around 150. But patients can be as high as 13, 14 and above. If the A1C is 13, just to give you an idea, that's an average blood sugar of 330. And that's an average. That means that patient probably gets up into the 400s and 500s after eating. So let's talk about blood glucose monitoring now. There are so many blood glucose meters on the market, and I really don't care what the patient chooses because insurance companies are going to tell you what they want you to use, or your budget will dictate what kind of meter you use. All meters need to be downloaded in my practice. Now, I know not all doctors do that, but I really want to look at verified blood glucose data. And so if you do go to Walmart and you decide to buy a generic rely-on meter from Walmart, please stick with the Prime, not the Premier, but the Prime, because we can download that. And this is a commentary for my patients that may be watching this program. Please always keep the date, time, and year set so we can download these meters on the computer. If you drop it or you change the batteries, you must reset the date, time, and year. But as a backup, please bring your handwritten blood glucose data to your office visit as well, because if for whatever reason we can't download that meter, then I have backup. So your office visit is not a wasted visit. Your blood glucose monitoring is designed to give you feedback on how well you're doing, but it also helps guide me on how to manipulate or adjust your medicines to fit your needs. What needs to be fixed? It will determine how I add in a new medicine or how I adjust insulin. Now, here's an important philosophy that's really typical of my practice. No data won't make any decisions. There will be no changes and unfortunately no progress in improving your glycemic control. So again, make sure you bring everything that you can to the table when you come visit your doctor so you get your money's worth and so it's not a wasted office visit. Now let's talk about blood glucose sensors. These are continuous blood glucose monitoring devices that check blood sugars every minute. And it gives us waveforms of your blood sugars, and I'll demonstrate. So, in the morning you're here, but when you eat, the blood sugar goes up and comes back down, and here's lunch, and then here's supper, and then here's through the night. So I look then and follow waveforms and look for patterns that help allow me to adjust the therapeutic regimen. Sensors take the guesswork out of it for me and make it so much more easier for me to adjust medicines, but also give me the confidence that I'm doing the right thing on behalf of the patient. There are currently 3 proprietary sensors on the market: Freestyle Libre, Dexcom, and Medtronic Guardian. And this is a picture of the Libre. You've probably seen commercials of this. It's just the little round disc that's on the arm. The patient will have a reader or they'll use their phone and they'll just wand it over the sensor and it'll give them their reading. We ask that patients using the Libre wand their sensor at least 4 times a day. First thing in the morning and right before bedtime, and then a couple times in between. So that pulls forth 8 hours of information so we can see the whole picture of what's been going on for this person throughout the day. And this is a picture of the Guardian. Now let's talk about what causes high blood sugars when you have diabetes. Less activity, sedentary lifestyle. During COVID, we were going up and up on insulins and medications, trying to compensate for a more sedentary lifestyle in which people were staying home and eating more. Now, illness and infections are stresses on the body, and those can raise blood sugars significantly. And during illness and infections, we want to stay on top of that hyperglycemia and keep it as well controlled as possible. If patients are not taking enough medicines, let's say you're missing pills or injections, you're skipping, delaying medications, or stretching it out because you can't afford your medicines, we'll see higher blood sugars. If, say, for instance, you're using insulin or another injectable and you're injecting improperly, we can also see high blood sugars from improper technique. Stress, whether it's emotional or physical, again, raise blood sugars. But more importantly, what happens when people get really stressed with all the stuff that's going on in our lives, diabetes gets put on the back burner. And so it's frequently ignored and it gets the upper hand of the patient. So remember, diabetes loves to win. So when you're sick and not doing well, let us help you and support you during those tough times. Medications like steroids, prednisone, and steroid injections raise sugars as well. So if you have an upper respiratory tract infection and you're given a Medrol dose pack, or you go see the orthopedist or pain management doctor and they're giving injections in your knees and in your back, you'll see these blood sugars go high. Call your healthcare provider so we can adjust your medicines to help with the hyperglycemia during that time. There are psychiatric medications that can also raise blood sugars, and they also can cause weight gain, and consequently play havoc with diabetes that we have to stay on top of. Cough syrups that are in sugary syrups will raise blood sugars, and cough medicines that have decongestants can also raise sugars. Even hormones like estrogens and thyroid can raise blood sugars as well. Now, what can you do to manage your high blood sugars? First, follow a meal plan that works for you. Later on in this presentation, I will dive into nutrition and proper meal planning. Make sure you have better food choices. Get rid of a lot of the junk and processed foods that seem to be our go-to on the run. And more importantly, if you're overweight, start to reduce your portion sizes. That's incredibly important. It doesn't mean that you can't have the foods that you like, but can you reduce the portion sizes so you're taking in less calories? Take your medications as directed. Don't skip, delay, or stretch. If you're having troubles affording your medications, it is up to you to communicate that to us, because we don't always know when you're struggling paying for your medicines. And let's face it, these medicines can be downright expensive. Some medications need to be taken at a certain time, especially rapid-acting insulins like Humalog, Novolog, Apidra, Admelog. These are rapid-acting insulins that are designed to cover food, and the only way they're going to cover food is if you take them before you eat the meal, and ideally 15 to 20 minutes before eating. A lot of times patients just pop this insulin in whenever, and then they wonder why their sugars go so high after eating. It's because you're taking the insulin too late. Insulins, the ultra-rapid acting insulins like Lumjev and Fiasp can be taken about 5 minutes before the meal, but still again, before the meal. There's only one situation in which you would not take rapid-acting insulin before the meal, and that's if you're having hypoglycemia before you eat. We would want you to eat your meal, get your blood sugar up, and then you can take the insulin as soon as you're done eating. We want you to check your blood sugars on a regular basis to give you feedback on your progress. But more importantly, it also helps me help you. So always keep that in mind. Please check before the meals, not after. We don't start working on 2-hour postprandials unless you're on a sensor or you're doing advanced management. So for basic education, we want to know, what are you doing before you start to eat? And so keep that in mind. Most of your diabetes management will be before you eat the meal, not after. It is important that you send in your data to your healthcare provider so that we can work in between visits to get you under better control. If we only look at your blood sugars every 4 months, it may take years to bring you under control. But if we're looking at your data every 3 to 4 weeks and we continue to make routine adjustments on your medication, then hopefully by your next appointment, that A1C is going to be much better and you can be really proud of your progress. Increase your activity if you can, but always exercise safely. And furthermore, allow us, by looking at your data and working with us, to customize your diabetes regimen to fit your needs. Talk to us about your work schedule, where you work. Are you in a coal mine? Are you a farmer? Are you a student? A lot of times we can really customize these regimens to fit your work schedule and your needs just by having that conversation with us. Now let's talk about low blood sugars. We focused on highs, so let's talk about hypoglycemia. Hypoglycemia are low blood sugars, usually under 70. Now I know some of you are saying, oh my God, I feel horrible when my blood sugars are 90, but 90 blood sugar is not life-threatening to you. You just may feel a little uncomfortable, but it is not going to create cognitive or physical problems like blood sugars under 70. Some people may have these symptoms when they're not low, but you may also experience symptoms of low blood sugar when the blood sugar is dropping rapidly. Pay attention to that. Check your blood sugar. If you find it to be dropping rapidly, take action. Now, a severe low blood sugar is when you need the assistance and help of someone else, like family, friend, coworker, or 911, and I'll talk more about that here in a bit. What causes low blood sugars? Too much insulin or medications, too much exercise, too little food, delayed or skipped meals, or too much alcohol. Alcohol suppresses the liver's production of sugar. And so in the context of taking insulin or diabetes medications that can cause lows and alcohol, we sometimes can see significant hypoglycemia. So what are symptoms of low blood sugar? Shaky, sweaty, hot, hungry, disoriented, not able to process things very well. Some people will be lightheaded and dizzy. You may notice a very rapid heart rate, that's called tachycardia, jitteriness, blurred vision. Hunger can occur, but hunger is nonspecific because a lot of my patients are hungry all the time. So check to see if the hunger is related to a low blood sugar or if the hunger is just hunger. Patients may experience numbness around the lips. There may be emotional changes. Some people will start to cry. There could be behavioral changes in children. They could misbehave. So before you discipline, you have to check their sugar. If it's not low, proceed on with discipline. But if they're low, treat the low blood sugar. Okay? And then other people may not experience many symptoms at all, especially those patients who may be taking beta blockers. These are heart medicine and high blood pressure medicines frequently prescribed by cardiologists and primary care doctors to lower blood pressures and lower heart rates. These medicines can block or mask your ability to sense a low blood sugar. Therein lies the importance of monitoring your sugars and keeping an eye on your numbers so we can pick up on early episodes of hypoglycemia and avert a future problem. So, a couple of pearls of hypoglycemia. Now, if you go through medical school and the head doctor says, I'm going to give you a pearl, that means you are never to forget this. So I have two pearls about hypoglycemia that I don't want you to forget. When you have one low blood sugar, you're going to have another within the next 24 hours. I can't tell you when it will happen, but more than likely it will. And you're not going to sense the second episode very well because you've depleted your body of the chemical signals with the first low blood sugar. So keep this in mind. Look for the second episode. The second pearl is that 50% of all episodes of hypoglycemia happen at night while you are asleep. Now, I have a lot of patients that convince me, or try to convince me anyway, that they wake up with a low blood sugar, but they don't because I watch what's going on with these sensors, and they may be low upwards of 3 to 4 hours through the night. So don't just assume you'll wake up if you're having a low blood sugar through the night. If you happen to get up and pee in the middle of the night, it's a good time to periodically check. If we're finding too low of blood sugars during that time, we can make adjustments in medication and prevent a bad low from happening through the night. So how do we treat a low blood sugar? We use the rule of 15. You'll take 15 to 30 grams of fast-acting carbohydrate or glucose. And I'm going to give you some examples of exactly what 15 grams looks like. Now let's use some common sense. If my blood sugar is 74, minor symptoms, I'm just going to use 15 grams, just enough to bring me up over 80, maybe 85 to be comfortable. If, however, my blood sugar is 40, 50, 60s, start with 30 grams. Start with a higher amount so that you can more rapidly recover from the hypoglycemia. After 15 minutes, retest. If the blood sugar is not rising, treat again. Be patient because I know it feels horrible when you have these lows, but it's really important that you don't overtreat such that you end up with blood sugars of 300, 400 because of just eating for the next 20 minutes. Okay. Now I want to give you some examples of fast-acting glucose. 4 round glucose tabs. This is what they look like. They're a big sweet tart, and they come in rolls or they can come in jars that you can get at the local drugstore. Now, if you're going through a bottle of glucose tabs, I think you need to have a good conversation with your doctor because you're on too much medication if you're going through a lot of glucose tabs. A regular can of pop, half a can is what we say, but I love pop. Why waste the other half? So a can of regular pop, not diet. And you be careful. Your friends who may not understand diabetes may hand you a can of diet. That's not what you need. You need a regular can of pop that has sugar in it. A half a cup of juice is really good, and juice is very powerful. You hear us frequently say orange juice. Anything except tomato juice will work. 15 to 20 Skittles, that's what comes in these bags. Patients may buy these fun packs during holiday season and keep them on hand. But remember, you got to chew Skittles, and sometimes Skittles can be hard to chew. That's why we like liquids or the glucose tabs that are pretty soft and easy to dissolve. 2 tablespoons of raisins or a box of raisins work really well. Raisins are pure sugar. And so they do an amazing job of raising blood sugars up pretty quickly. Okay. Jelly beans, the little tiny jelly bellies, 15. In fact, 1 jelly belly is 1 gram of carb. Now, if you're using the big ones, that would be 6 big jelly beans. Okay. 3 soft peppermints. If you ever go to a restaurant and they give these at the end of a meal and you collect 3, you have 1 treatment for low blood sugar you can put in your car and let it remain there should you ever need it. Here's some others. 4 Starburst. Let me turn that. Starburst. For Halloween, we always go over 9 pieces of candy corn. Okay. Only 2 pumpkins for Halloween. What about these sour cherries? 6 sour cherries. Right. You can use glucose, liquid glucose or glucose gels that you find in sports stores or in drugstores as well. This would be 1 packet. This is what athletes use while they're out on long runs or training. So I think those are some pretty good examples of what you use to treat a low blood sugar. But what if you go into someone's home and they don't have those? What else can you use? Keep in mind a tablespoon of honey, a tablespoon of jelly, or a tablespoon of just table sugar, white sugar will also work. So there's lots of options typically, although I've had calls from patients in which they had nothing in the home to treat a low, and that gets pretty scary. So please always have something put back for an emergency should you need something to treat a low blood sugar. All right, let's move on. Notice I didn't say peanut butter and crackers or cheese and crackers. Why is that? Well, peanut butter and cheese are made up of fat and protein. There's no carbohydrate in peanut butter and cheese. And fat and proteins delay the absorption of carbohydrate. So when you use peanut butter and crackers and cheese and crackers, you're actually delaying your recovery from an episode of hypoglycemia. So it does not make any sense at all to use peanut butter, cheese, meat, things with fat and protein in them. Okay, and again, I mentioned earlier, no diet pop. Now, let's say you've adequately treated your low blood sugar and it's over 80 now and you're feeling better, but it's a couple of hours before your next meal and you would like a snack. By all means, have a snack. If that is peanut butter and crackers or cheese and crackers, by all means, have that. That will be fine. Keep in mind, though, that those packets of peanut butter and crackers and cheese and crackers are upwards of 240 calories. So be careful about the amount of extra calories you may be consuming. That can lead to weight gain, especially if you happen to have a lot of low blood sugars. So now let's talk about the treatment of severe low blood sugars. A severe low blood sugar is when you are unable to help yourself. You need assistance of others, whether it's family, friends, coworkers, or 911. Typically, a severe low blood sugar is a blood sugar less than 54. Patients will exhibit unusual behaviors. So they may have seizures. They may be unconscious and found down. They're acting funny. They're not able to do a task at work that they're usually very proficient at. They could have a very severe low blood sugar. Now, if you're unable to swallow or unconscious or unable to follow instructions, we don't want anybody putting anything into your mouth. So now I'm speaking to your family and friends. The management of a severe low blood sugar would then require the use of a glucagon emergency kit. So it's really important, again, to not put anything into anyone's mouth for fear that they might aspirate and choke on what you've put into their mouth. I remember working in the ER and a patient came in and had orange juice and sugar all over their hair and their body because the family was just, I think dumping things all over the patient. If the patient is having a lot of unusual behaviors, don't go that route unless you feel that they can adequately swallow. Then you can offer them a liquid, but probably not something to chew. When in doubt, pick up your phone and your finger and you call 911 and you call for help. In the meantime, if you do have access to a glucagon emergency kit, then use it. This is the time to help save your loved one's life. So let's talk about some of these preparations that are currently available on the market. We have the glucagon emergency kit that usually comes in a kit like this. We have Gvoke and Baqsimi that I'll demonstrate here in a little bit as well. Glucagon comes typically as a powder. Glucagon is a hormone that stimulates the release of glucose from the liver. This hormone is either given via injection or it can be squirted into the nose, and I'll demonstrate that here in a bit as well. The injectable may need to be reconstituted, and I'm going to demonstrate that here in a little bit as well. Remember, glucagon raises blood sugars while insulin lowers blood sugars. Now, if you don't have diabetes, insulin and glucagon work together to keep your blood sugars normal. But when you have diabetes and you have insulin on board or a sulfonylurea oral pill on board that can cause lows, your glucagon may not be able to work as effectively during these situations of hypoglycemia. Now, these kits are stored at room temperature, and it's really important that families put them where everybody knows where they're at, preferably not in the bottom of mom's purse, if you know what I mean, because you're not going to find it when you need it. So make sure that there is an agreed upon location where this kit is placed. If you go on vacation or your schedule is really being altered, that's when you might get in trouble with a severe episode of hypoglycemia. So make sure you take one with you while you're on vacation. When you pick these kits up from the pharmacy, make sure that there is a long expiration date on it. You should have at least 1 year to 2 years of expiration. So do not accept a kit that only has 2 to 3 months before it expires. After you inject or give glucagon, it's important that you lay the patient on their side. Glucagon can make the patient nauseated and possibly vomit, and so we want the vomit to come out and not be aspirated down into the lungs. Now, when the patient recovers, it's really important that they have a snack or meal that has carbohydrates in it. Again, the patient will need to refeed to replenish the glucose in the liver. And then once you use a glucagon kit, remember to get another one from the pharmacy. So let me demonstrate this. So this is the old-fashioned glucagon emergency kit. We now have better preparations, which I'll demonstrate here in a bit as well. Okay, so you have a syringe with what looks like water. We call it a diluent. And then you have the little vial with the pellet, the powdered pellet of glucagon. What you do is you take the needle, you put it into the little vial, and you're going to inject that water and then shake it and mix it up. Now, you're going to be scared when you do this. So I always say use that energy, that nervousness of having to help someone with a severe low blood sugar to shake up your glucagon. You pull it all the way back, fill the syringe, and now you administer this injection. Now, some people who've never given an injection, this might be very scary. And that's why if your loved one is on insulin, they should ask you to periodically give them an injection to practice how to inject something. This can be given in the thigh, in the arm, in the abdomen, and in the buttock. If the patient is combative, you can go right through the clothes. So you can hit them from behind in the butt and give it right through the clothes. I mean, this is an emergency situation. You need to address this patient quickly to help them get that blood sugar up so that they can get back to a normal state. Now I'd like to demonstrate two other newer forms of a glucagon emergency kit. The first one is called Baqsimi. This is a glucagon emergency kit that comes in a powder and is just put inside the nose and injected. Okay, that's Baqsimi. And so for people who are reluctant to give injections, this might be helpful for school nurses taking care of young children who are having hypoglycemia. This could be very helpful for patients or patients' families who are uncomfortable giving an injection. Now, my favorite new glucagon emergency kit is called Gvoke. It's a pre-filled pen. I just demonstrated how to mix the old glucagon emergency kit and how people might get nervous and shaky. Well, this is a pre-filled pen. It's all ready to go, and this is called Gvoke, Gvoke. You just pull off the top, and then I'm going to demonstrate on my arm, but this can be given elsewhere. But you just press and it's given, and that's it. I tend to be old-fashioned. If a patient is having hypoglycemia, I want to know that the product is in their body, hopefully in a muscle or subcutaneous, and not wondering about whether it's being absorbed adequately from the nose. But supposedly Baqsimi is also very effective, but my tried and true favorite right now is called Gvoke. Because you might be at risk for having low blood sugars, it's really important that you wear some form of diabetes identification. And this is an example of a small malleable piece of metal that people wear on their watch bands. A lot of people wear necklaces, bracelets, jewelry that identifies them. Some of my other patients prefer permanent identification. So be kind of particular of what you choose to put on your body permanently, and make sure, though, it's visible to anyone who might come upon you and wonder why you're behaving funny or behaving in an unusual manner. And then be very careful what you do, because this person's identification is on his leg. So if he's wearing pants, has shoes and socks on, no one's going to find this identification. And you can see the turmoil that diabetes has created in this patient's life, and it's reflected in permanent tattoo.